Okay, hi guys. This is Latoya from the Registered Nurse TV. Here I'm going to be doing an interview with our nurse Yoni Charis, Yoni Lam, one of our registered nurses, our male nurses. He is all the way from Cameroon, Africa. So welcome,
Yeah.
Yoni. Welcome.
Thank you very much. Thanks for having me.
Good, awesome. You're my first male nurse to interview. So first, I'd like you to tell me a
Whoa.
bit about yourself.
Oh, awesome. So I'm Yoni Lambe from Cameroon. That's Central or West Africa. And I studied in the States I was in the States for about 7 years. I went to college there, and then I moved to Bermuda when I got married to my wife. And we decided to move to Bermuda. And since then, it's been 5 years now. So
Wow.
I'm in Bermuda now, working at BHP as a registered nurse.
Awesome, awesome. So can you tell us what made you do nursing?
Well, several reasons. The number one actually was the fact that, with nursing, once you get you graduate, you're almost guaranteed to get a job anywhere in the world. That was
Mm-hmm.
one of the things. Another thing is I just have a passion for looking after people. We have a bunch of nurses in our family, male
Okay.
nurses, of course. My
All
cousins,
right.
I have a bunch of cousins who are nurses.
Awesome. Awesome.
Yeah,
That's nice to hear.
yeah,
That's
yeah,
nice. Awesome.
yeah.
So you say 5 years you're a nurse. So how long was your studying take? How did it take? How long it take you to become a registered nurse?
Well, in Texas, is a 4 year program.
All right.
So you do 2 years of general classes, like
Mm-hmm.
politics, economics,
Mm-hmm.
government, or whatever, all these history. And then after you 2 years, you get into the nursing school. It takes about 2.5 years to complete nursing school, depending on where
Okay.
you are in the States. Yeah.
All right. All right. So what would you tell an aspiring registered nurse? Something that you wish somebody could have told you.
Oh, wow, that's a lot. That's a loaded question. Anyways, sometimes you get excited about something, and then when you get in, you're like, man, I wish someone had told me this. I think number one is it's always good to communicate with people and to hear their perspective, before you get into something. Especially I'll say like a master's degree. I have a master's in education,
Nursing.
um, in nursing education.
Okay.
If I were in the States today, I think I would have done something different, something maybe like a nurse practitioner. And the reason is because with an education degree, it's really not much you can do, in Bermuda. It's a small place, the market is not as wide as, in
Yeah.
the States.
Yeah.
I wish I had, anyways, I don't want to look back. I don't want to look back seriously. But
Okay.
I'm enjoying it and I'm using it, of course.
Okay.
The skills such as research skills, being able to
Mm-hmm.
communicate, writing, all of that is helping me today. And who knows, maybe tomorrow I'll be able to use it in more, I'll use it widely in a different capacity.
Awesome.
Yeah,
Awesome. So, what would be a best experience for you in nursing? Like, what would be your best description of nursing for you? Like
yeah,
something that's stayed on your heart.
yeah. I think it's very, very intense. It's very intense. You know, um, And the reason is because you're not only dealing with patients, you're dealing with patients, you're dealing with other nurses, you're dealing with other people that work on the ward, and then
Mm-hmm.
you're also dealing with families. So
Right.
it's really, really intense. You're always trying to please people. That's the thing about nursing, you're not trying to give a wrong impression of yourself, especially to families and patients. And that can weigh you down,
Okay.
it's a very, yeah. Also, I think it's rewarding, in the sense that sometimes when people walk into the wards, they're sick, and then when they leave, they're doing well, they're feeling
Mm-hmm.
much better,
Yeah.
especially with COVID, like
Okay.
you and I mean, we work on
Yeah.
the ward, so
Yeah. So we see
we've
it.
seen, yeah, we see it all the
Mm-hmm.
time. Yeah, I
Mm-hmm.
think that's one of the most rewarding aspects of nursing.
Okay. So,
Yeah.
is there any part of nursing that you specifically love? Like, yeah, that is your you love that part. That's specific. Like some nurses would say they love doing dressings. Some
Yeah.
nurses love wound care. Some nurses love ENT. Some nurses love geriatrics. What type of
Yeah.
nursing, since you've been actively doing nursing,
Yeah.
which one do you love?
I think I have a few. I have a few of them. I like geriatrics. I like dealing with older people. Unfortunately, on the ward, yeah, we do have quite a bit of older folks that we
Elderly.
look after.
Yeah.
Yeah,
Mhm.
but not on a geriatric. We're not a
Not
geriatric ward.
geriatric ward. No.
Yeah, I really like dealing with older people. I'll give an example. Like for example, when I was in the States going to school, I actually looked after an older guy, who eventually passed, and he was the one who actually helped me complete my education. I mean, the family paid for my schooling and everything. So I really, really do love looking after the
Elderly.
elderly. Yeah. Also, I like IV therapy. Quite honestly, even though I don't use it as much here, I really do. I think I just get a kick from from just doing IVs all day. I could do that. Yeah,
Okay.
yeah. And then I like
Awesome.
dressing. I like dressing change. I like that as well. Just
Okay.
changing dressings and yeah,
All
passing
right.
Foley catheters and
All right, all right. So you are a
yeah,
male nurse. What will be your perspective compared? Because I know a female might have a different look at it. So what would
yeah,
be your perspective? Like another male is telling you, Mr. Yoni, I'm thinking of doing nursing. What would you tell him
yeah.
to prepare himself for working with all these women? Because you're
Oh
surrounded with
yes,
women.
yeah. Oh my God, that's a very interesting question. Yeah. I think right now there's a growing trend now. A lot of men are going to nursing, and I think it's great. And one of the things I would say is you have to be patient with women and try not to argue with them. Always know that women they always win. On the ward, don't argue with them. Don't try to argue. If you argue with them, you're gonna make your life quite frustrating. So don't argue with them. Always be a good listener, and and don't react. Be a good listener. Speak when it's time for you to speak, and I think you're gonna have a good time. If you just assume that it's just like marriage. As men, we always assume that the wife is always right. We just go with the flow. We just
I
go with the flow.
understand.
Hey,
I
you guys are always
understand.
right.
Okay,
Yeah,
okay, okay. Awesome, awesome. So is there anything you'd like to tell us, our community, the nurses community, because this community is for all level of nurses, from the PCA to the nurse
yeah,
practitioner. Is there any message that you'd like to put out there for anybody to hear that you can take from your heart and give out to others?
yeah. I think if you practicing nursing, you should do it with all your heart. Don't do it as though you're trying to please your manager, you're trying to please the organization, or you're trying to please your coworkers. Do it as something that you feel like it's like a calling to me. Do it like you're doing it unto God. You're doing it to give your best so that people can feel better when they leave or when they get that kind of treatment from you. Love what you do, be passionate. If you're not passionate, if you don't love what you do, you're always going to be frustrated, because I mean, like I said, the ward is very intense. You don't want to come to the ward all cranky,
And tired.
just yeah, and tired, and just even when you have issues, personal issues, make sure when you come to the ward, keep a good attitude, and you do well. Yeah,
All right. Awesome.
yeah.
Awesome. Thank you, Yanni. Thank you for this
Oh,
interview. Thank you for giving us your time. I know
thank you,
your son
thank you,
feels
thanks for having me.
your son sounds like he want to have your little attention right now.
I know, I know, I know, and also I'm supposed to go back to sleep.
Oh, you worked
Oh,
last night.
I worked last night, and I'm supposed to be there
You
tonight. Are you
working
coming
tonight?
tonight?
No, I'm off today. I'm off today.
Oh, okay.
Yeah. So
Yeah.
remember,
He,
nurses do it better. And as Yoni said, we
yeah.
have to do it with all our hearts. All right.
Yeah, yeah.
Thank you,
hmm
Yoni.
Thank you
Thank
very
you
much.
very much.
Thanks for having me. All right, I'm
All right.
going.
Bye.
Yeah, bye.